So we have optimal levels. Again, I don't look at reference range levels and say, oh, you're normal, even though you have 10 different symptoms. Let's just send you on your way. You guys are not crazy. And that's one thing that I think that I hear so many times when patients come in to see me is that, so I'm not crazy? I feel like I'm crazy because everyone tells me that I'm normal, but I know I'm not normal because these things are happening to me. I promise you, we will get to the root of the problem. We have to figure out what the problem is first. The other thing I want to impress upon is ordering just a basic panel of thyroid with both antibodies. The reason we check these antibodies, and this doesn't have to be an every 6-month occasion, but I say at least check them initially and make sure that they're not positive. Antibodies will also show us for autoimmunity. You don't know how many times I've had patients come in and they were told that they were normal and we now have Hashimoto's because no one has checked it. I want people to be aware of this and aware of this severity and how we can possibly prevent this in the future by just treating the thyroid. So whether it be replacing nutrients to support that conversion, or it just may be possibly replacing thyroid. There is no harm in truly getting to the point of being, on a medication. So that is probably the second topic I want to talk about is the importance of what medication is chosen for thyroid and why we have such an epidemic of prescribing levothyroxine or Synthroid. So that's what we are taught in school. I've spoken to physicians, I've spoken to PAs, I am a nurse practitioner, I know what we were taught, and it's all pretty similar. We are taught we get a TSH, we maybe check a free T4, and if the TSH is between the lower limit and 5, and they are not having symptoms, we leave it as is. We do nothing. However, it's from 5 to 10, which let me tell you is extremely high. No one should ever be within that level, but if they are and they don't have symptoms, which we usually don't go over with you what those symptoms might be, is that we might treat. If you have symptoms, we treat. If not, we let it be, and we monitor it again in 6 months to a year. The problem with that is that we're not, again, seeing the underlying problem. What is your T3? Are your cells getting the active T3 to do its job and to do its magic and help you lose weight, burn fat, get rid of the brain fog? The downfall is the medication that we were taught to give is levothyroxine or Synthroid. The downfall with that is that it's only T4. So what that does is when you only receive T4, we are putting into assumption that T4 is converting naturally to T3 and giving your body what it needs. And I don't know about other providers' population, but I know with the patients that I see for thyroid, about 90% of my patients are not well controlled on T4. They still have symptoms. And what happens is that when they initially get put on it, they may feel great for the first couple weeks, couple of months, but then guess what? It starts to subside. They start to get symptoms back. They're saying, well, I still don't feel good. Well, your numbers look great, so we're leaving everything as is. Well, that's very frustrating because unfortunately your T3 it's probably not converting. And that's about 85 to 90% of what I see is poor converters. We're not getting the nutrients, or the stress level is so out of control that we're not discussing stress management. So I want people to understand that the levothyroxine and Synthroid, it is a great medication if it works for you. And there are a small percentage that it does work. So I say if it's working and you feel great, then stay on it. There's no reason to change something if it's working. But if it's not, that's where we need to discuss other options to where it's a desiccated thyroid that includes T4 and T3. So even though we're giving your body a little bit of T4, we're also giving it T3, what it's actually truly lacking. And that actually makes people feel so much better. So it's an adjustment period. I tell people with any type of hormones, it's slow to respond. Thyroid is no different, but that is why I keep a very close eye on it. If we do start medication, then I am going to recheck lab values in 4 weeks. We will readjust as needed. So I just want people to understand the importance of thyroid, what it does, and that there are truly over 40 signs and symptoms of hypothyroidism. Again, please consider that thyroid is the master gland. It controls every cell in your body and affects every other hormone. So we have to be careful and know what we're asking for. And again, if they don't are not willing to order that, please find a provider that would be more understanding and that would order the test that you're requesting.